Receiving a prostate cancer diagnosis is a difficult experience and leaves patients and their caregivers feeling anxious and overwhelmed. In addition to being more likely to be diagnosed with prostate cancer, a prominent study suggests Black men are more likely to die from low-grade prostate cancer. For African American men, the risk of dying from low-grade cancer is double that of men of other races, a recent study found. Today, we wanted to discuss the basics of screening and discuss prostate cancer, its management, and why participation in clinical trials are so important. Hello, my name is James Jones, and I'm with the Houston, Texas Alumni Chapter of Kappa Alpha Psi, and we have partnered up with Black Health Matters to bring you an important discussion on prostate awareness and prostate cancer. Today, I bring you the presenter, Dr. Paul Gettings. He's a board-certified urologist and one of the country's leading sexual medicine experts. His practices in Philadelphia and New York, Centers for Sexual Medicine, was formed to combat all forms of sexual dysfunction, hormone replacement, and male infertility. Dr. Gettings, I'd like to begin our discussion by asking, why should Black men be so concerned with their health, and what should we be doing about it?
Well, James, thanks for having me. It's really an honor to be here. I want to thank Black Health Matters as well as Bristol Squibb to allowing me to talk about such an important topic. So in terms of what this all means, when we look at Black men, unfortunately, in terms of health outcomes, we have the lowest rates. So we have the highest rates of diabetes, highest rates of hypertension, obesity, heart disease, colon cancer, prostate cancer, especially when we compare it to white men. Unfortunately, also, we have, when we do get prostate cancer or colorectal cancer, statistics show that we're more likely to have an aggressive disease, as well as we're more likely to die of these problems. So it's a significant problem.
So Dr. Gettings, I would also like to know, what is the prostate gland and what does it do? I mean, what's its primary function in our bodies?
Okay. So before we talk about the prostate gland, I wanted to talk a little bit about screening, and then we're going to get to the prostate, because I think the prostate is so important. Okay. When we talk about screening, and this is outside the prostate, I want to talk about some things that are also common, such as high blood pressure, diabetes, and colorectal cancer. And it's so important for us men to understand what the screening process is like. So the screening process starts with, your family history. So if you have a family history of high blood pressure or diabetes or colon cancer, you should really be talking to your doctor about getting screened, okay? If you're exhibiting symptoms such as a headache or blurred vision, that might be a sign of high blood pressure. If you're going to the bathroom frequently, and if you're going more urgent and you're thirsty, that might be a sign of diabetes. If you're having blood in your stool, that might be a sign that you have colorectal cancer. So the screening tests that we do, for high blood pressure, we want to get our blood pressure checked. And so that's going to your primary doctor on a yearly basis, and them checking your blood pressure. For your glucose levels, it's a simple either a blood test or a finger stick, and that'll allow us to see if you have early diabetes. And for colon cancer, what we want to do is we want to get a colonoscopy. And for most men, that's about 50, unless you have a family history or unless you see blood in your stool or what have you. Then you want to make sure you get a colonoscopy, and you'll see a gastroenterologist for that. But first, you want to go to your primary care doctor, okay? And then for prostate cancer screening, before we talk about the prostate, before we talk about the screening, let's talk about the prostate in general, okay? So we'll go to the next slide. So where is the prostate? How does it function? And what's the importance in men? So the prostate's a gland, okay? It's underneath the bladder, as you can see in this picture here. It's responsible for a lot of things. One of the things it's responsible for is it secretes an enzyme that makes the semen less viscous. For one, it actually provides a lot of the fluid in the semen. And the other thing, it provides a channel from urine that goes from the bladder then to the urethra. So as guys get older, what could happen is something called BPH, which is benign prostate hypertrophy. That's when the prostate gets enlarged. And when it gets enlarged, it starts to squeeze that urethra. And so guys can have some problems with going to the bathroom more frequently, getting up in the middle of the night, having a weak stream. And so in that situation, once again, you want to make sure you go to your primary care doctor. Another thing is prostate cancer, unfortunately. Prostate cancer affects, as we mentioned and I talked about, affects many men. What it is it's when abnormal cells in the prostate start to overgrow the prostate, and it starts to destroy the prostate, and then it can spread outside the prostate. It's called metastatic prostate cancer, and men can actually have some problems and die of that.
Okay, so my next question is, can I prevent getting prostate cancer, or is there anything I could do to decrease the risk of prostate cancer, Dr. Gettings?
Yeah, so in terms of preventing prostate cancer, at least as of right now, there's nothing that we know of that can prevent you from getting prostate cancer. But there are things that we can do to lower the risk, right? And so one of the things is what we eat. And so diets low in saturated fats. And so what's saturated fats? Saturated fats are like bacon, hamburgers, butter, lamb chops. All those types of food can possibly increase your rate of getting prostate cancer. You want to increase your daily fruits and vegetables. You want to maintain a good, healthy weight. If you're smoking is not good for anything, especially not any type of cancer. So you want to make sure you can stop smoking. And then exercise has also been shown to possibly lower your rate of prostate cancer.
Okay. So earlier we talked about screening for hypertension, diabetes. What about screening for prostate cancer? I mean, what is there to do for us to go out and find out if we are at risk of getting prostate cancer?
Yeah, so for screening, again, screening is checking for something that you're not having symptoms for as of yet, right? So, and for prostate cancer, unfortunately, there's no real early signs or symptoms of prostate cancer, right? So what we have to do is we want to be able to catch it early, treat it early, so we can hopefully improve survival of prostate cancer. And so there's two things that we do. One thing is called PSA, which is prostate-specific antigen. So that's a blood test. The other thing is that's coupled with a digital rectal exam. And so your primary care doctor can do this. Your urologist can do this. It's just important that we get these things done. Recommendations are trying to get it done around age 50. If you have a family with a family history of prostate cancer, or even if you're an African American, we really want you to get it earlier. And some of the guidelines say you can actually get it at 40 years old.
Okay. So Dr. Gettings, you brought up for African Americans to get screened early on. So why is screening so important for prostate cancer in African American men?
Yeah. So us as African American men, we really get the short end of the stick when it comes to prostate cancer. You know, there's a number of statistics out there. There's some statistics that say that we're more likely to get diagnosed, 1.8 times more likely when you compare us to white men. We're more likely to have aggressive prostate cancer. We're more likely to die from prostate cancer. So this is something that obviously all races deal with, but African Americans, we deal with it. We deal with a more severe type of disease.
Okay. So if an African American man, unfortunately, is diagnosed with prostate cancer, can you discuss some of the treatment options that are available for that person?
Okay. So in terms of treatments for prostate cancer, it really depends on the type of prostate cancer or the grade of prostate cancer that you have, right? So once you get diagnosed, if you have an elevated PSA or if you have an abnormal rectal exam, the next step is to do a biopsy, right? And in that biopsy, you have a pathologist that looks at the biopsy slides, and they grade you and they give you a number scale. And essentially the number scale is low risk, medium risk, and then high risk, okay? And then from those categories, what happens is you're treated depending on where you are, right? And so there's a number of different treatments, a number of different flavors of therapies for prostate cancer. I'll go through them. So there's observation and active surveillance. So observation is when you're just watching the prostate cancer. Usually, men that undergo observation are a little bit older. They have a lot of other medical problems, and they're probably going to die of something else as opposed to prostate cancer. So those patients are just watched over time. There's active surveillance. So these guys have chosen not to have treatment. We'll go through treatment, but they are watching the prostate cancer a little closer than just observation. So they're going into their doctor. They're having frequent rectal exams. They're checking their PSA, making sure it's not going up. They're also having biopsies done. And if, say, a biopsy goes from low risk to medium risk, then they may say, all right, doc, I think I want some type of treatment. Okay. And the type of treatments are surgery. So surgery is one. And so surgery, it comes in two different flavors. There's one where there's open surgery, and there's one that is a little fancy. It's called a robotic prostatectomy. And that's when the prostate is actually surgically removed from the patient. There's radiation therapy, and radiation are beams of therapy that actually kill cancer cells. And they could be done, it's external beam radiation, where you actually have these beams that are focused on the prostate, or you can have these radioactive seeds that are actually implanted into the prostate. There's cryotherapy. Cryotherapy is used in very select patients where they're actually freezing a portion of the prostate or the whole prostate. There's hormonal therapy. And for hormonal therapy, they're suppressing certain hormones to fight the prostate cancer. That's usually used in only in certain cases, especially if it's metastatic prostate cancer. There's chemotherapy, and chemotherapy is usually it's an IV therapy that's placed in the veins, and the therapy is cytotoxic. That means it kills the prostate cancer cells. And the last one is immunotherapy. And immunotherapy is one of the new therapies that we're using for prostate cancer. And in this situation, we're enhancing the immune system in some way where it's seeing the prostate cancer, it's fighting against the prostate cancer, but your body's doing most of the work. Okay?
Yes, sir. So, Dr. Giddings, if I go to get screened for prostate cancer, what doctor should I go see? Should I go see my primary care physician, or is it some specialist that I need to go see? Who would I go to seek help for prostate screening?
That's great. So let's go to the next slide for that one.
Mm-hmm.
So in terms of the physicians that screen and treat prostate cancer. So for screening, your primary care doctor is a good place to start. They can do the blood test, the PSA. They can also do a rectal exam. If you have a urologist, your urologist will also be able to do that. In terms of treatment for prostate cancer, as I mentioned, there's a lot of different types of therapies, and those therapies are done by different physicians. So urologists or surgeons. So urologists can do a number of things. They can provide surgery. They can provide hormonal therapy. They can also provide immunotherapy. Radiation oncologists, these are physicians that are primary care doctors, but they've done special training in oncology. Sorry, those are medical oncologists who are internists, and they've done special training in oncology. And those physicians can then deliver chemotherapy, hormonal therapy, or immunotherapy. And then there's radiation oncologists, and radiation oncologists are physicians that would administer the radiation, either the brachytherapy or the external beam therapy.
Okay. So when we started, Dr. Giddings, you brought up clinical studies, clinical trials. How can they possibly improve outcomes, these clinical trials?
Yeah. So what's a clinical trial? So clinical trials are studies that are used to investigate new drugs or devices, right? And when we talk about clinical trials for example, prostate cancer, these trials are kind of using medications or trying to figure out if these medications are going to work on prostate cancer, if they're going to help to either treat prostate cancer, or they may even lead to other things down the road that would also help to treat prostate cancer. There are crucial steps in improving how we find cures for diseases, and we improve health, and we improve outcomes, and we improve death rates for cancer. So these are really important trials that really need to be done. And so they're very important, and we'll talk about why we need to, as African Americans, to participate in these trials a little bit later.
Okay. So who regulates it? Is there some agency or does the government, who regulates these clinical trials?
Yeah. So one of the things about clinical trials is just not anyone can just set up a clinical trial. That's just not going to happen. These trials are regulated on several different levels. They're regulated by the FDA, which is the Food and Drug Administration. They're regulated by the National Institutes of Health. And even on a smaller scale, like for instance, if I wanted to set up a study, I would have to go through an institutional review board. And these are review boards that are set up by hospitals or set up by other agencies where they have ethicists on there, they have physicians on there that are looking at the trials, and they all have they all have the patient's best interest in mind. So they're safe, they're looked at, and there's a lot of oversight.
Okay. So are there steps or phases that these trials go through? And, is there a time frame that the clinical trials take place?
Yeah. So there are for clinical trials, there's a number of different phases that you may hear about. You'll hear about phase 1, phase 2, phase 3, and this is when when they're involving human participants. But even before they get here, a lot of medications or devices are already tested on animals or in the lab. Okay, but when we talk about phase 1, phase 2, phase 3, we're talking about more human participants. So phase 1, they're looking at safety of a medication or a device. Phase 2, they're looking at the efficacy, and they're evaluating any type of side effects. And phase 3, they're comparing how this drug or this device compares to something else that might be on the market. Because the whole goal for these clinical trials is if it's a new drug, you want to be superior than something that's already out there, or you at least want to be equal to that.
Okay. So why are clinical trials important for prostate cancer and African American men?
Yeah. So why is it important the basics behind that is we need to know what medications or what devices are going to work best in Black men and African Americans, right? Because of all the reasons why I said before. It's really important that African Americans participate in these trials. We're underrepresented in these trials, right? So we're not sure if a trial only has a small number of Black men and say they have the majority of white men, we don't know if these drugs are going to work for us. So that's the crux of it. It's a big opportunity, I think, for African Americans to be involved. One, it's going to help. It may help you as an individual if you do get a treatment arm. It may not, because with trials, sometimes you may get the drug, you may get a placebo. So there's no guarantee you're going to be able to. You may be helped, but it may help other people like you in the future. So I think that's the most important part. And I think that's why African Americans, we should really think about or consider these clinical trials.
Okay. And so how do we get involved? How would myself or any African American man get involved in prostate cancer clinical trials?
Yeah. So there are hundreds of trials for prostate cancer. Obviously, first you're going to be diagnosed with prostate cancer. You'll be in that low, moderate, or high risk category. And then from there, I would talk to your primary care doctor, or I would talk to your urologist to see if there's any trials that they're participating in, or maybe they can recommend some trials that you can possibly participate in. There's a lot of other information out there. One is bmsstudyconnect.com. So there's trials that are there. If you look through the trials and you're not eligible for some of those trials, there's clinicaltrials.gov, which is also available.
Okay. Well, we have time for a few more questions. So one question came to mind is sexual dysfunction or sexual ability. If one has prostate cancer, will they still be able to be intimate with their wife or their partner? Could you answer that? Answer that question?
So there's a lot of data behind sexual function after the treatment of prostate cancer. There's two big factors when it comes to men being able to resume sexual activity after they've been treated. One of the factors is age. So the younger you are, the more likely you are to have good sexual function afterwards. And that cutoff is usually around the 50s, right? Another factor is if you had good erectile function before. So if you had excellent function before, you're more likely to have good function after you've been treated for prostate cancer, okay? That being said, there are a number of men that have some complications after therapy. Some of the complications are some incontinence. The other complication, as you mentioned, is erectile dysfunction. I want everybody to know that that's not a reason to not get treated, is if you're going to have erectile dysfunction. I treat erectile dysfunction for a living, and there's a number of therapies that we can do to help a guy with their sexual function after they've been treated for prostate cancer. So it's not a death sentence. We can help you, get treated for prostate cancer, and you let me do the rest.
Okay, that's good to know. Another question, doctor, is when is the first time a person should go and discuss prostate screening with their primary care physician? I mean, what age group?
Yeah. So in terms of screening for prostate cancer, the numbers have been going left and right for a number of years. We know that Black men, have a more aggressive form. We know that it's more common in Black men. So, the recommendation for most men is around 50. With a family history, it's around 40. So if you have a family history of prostate cancer, I would suggest, especially like a first degree family member, like your father, your uncle, your brother, I would suggest getting tested with the PSA rectal exam, starting around 40, so you can get a baseline PSA, and then they can follow you from there. But if you're older and you're above 40 at this point, I would say, and you're in your 50s, you should definitely have one right away.
So, Dr. Gettings, I'd like to conclude our presentation. If you could, just some final words on prostate cancer and prostate awareness and why it's so important.
Yeah, James, thanks for having me. It's hopefully everyone listening is going to gain something from this talk. But just in conclusion, as we spoke about earlier, we as Black men really need to take more charge of our health, right? So, when we talk about the basic screening of blood pressure, the basic screening of checking your glucose, getting your colonoscopy, those are so important. And then when we talk about prostate cancer, as Black men, we have, more aggressive prostate cancer. We're more likely to die of prostate cancer. So screening is really, really important for that. Okay. And then when we go into clinical trials, we really need more participation for clinical trials. We do. We have to figure out a way. We have to understand what's going to work best for Black men. And the number one way to do that is for us to participate in these clinical trials. So those are some points that I really want to leave with the audience, which I think are really important.
Okay. Is there any websites or that you can go to, one can go to participate in studies or what have you?
Yeah, so as we alluded to a little bit earlier, the bmsstudyconnect.com I think is a good resource. Okay. For patients to go to. There's clinicaltrials.gov, which is also a good resource. But also, just as I mentioned, talking to your primary care doctor, talking to the urologist, and asking what trials they're participating. If there's any other groups in town that have, or universities in town that also have clinical trials, I would urge some of the listeners to contact them.
Okay. Well, Dr. Gettings, I really appreciate your insight on this important topic, prostate awareness and prostate cancer. And just thank you and good evening.
Yeah, it's been great. Thanks so much.
Thanks for having me. Okay.
All right.